Hello, my name is Emma, and I am discussing the Unit 5 discussion post, and today is February 13th, 2024. To get started, the National Labor Relations Act, or NRLA, is a policy of the United States used to encourage collective bargaining by protecting workers' full freedom of association by providing employees at private sector workplaces the fundamental right to seek better working conditions and designation of representation without fear of retaliation. The reference I used here is National Labor Relations Act, no date. According to the NRLA, individuals and employees have the right to self-organization, to form, join, or assist in labor organizations, to bargain collectively by representation of their own choosing, and engage in other activities for the purpose of collective bargaining. Bargain collectivity is the performance of the employer's mutual obligation and the employee's representation. Individuals and employees also have the right to refrain from any or all activities except to the extent that such right may be affected by an agreement requiring membership in a labor organization. Unions and employees are obligated to bargain collectively by meeting at reasonable times to confer in good faith with respect to wages, hours, and other terms and conditions of employment, or the negotiation of an agreement or any question arising thereunder, and the execution of a written contract incorporating any agreement which, if requested by either party. The reference here is National Labor Relations Act, no date. Questions a nurse should ask prior to making a decision about unionization are, what are the nurse's rights and protections? What is the current work environment like? How are negotiations currently conducted between nursing staff and management? And how might unionization impact the quality of patient care? A group of nurses seeking to find unionization may be prompted due to physicians not seeing critical patients in a timely manner, which puts the patient at risk, lack of administrative support among all healthcare professionals, deficient patient handoff procedures causing many errors and conflicts, and inadequate addressing of nurse staff continuing education and unit-specific competencies. The reference here is Cherry and Jacob, 2023. Advantages of unionization include job satisfaction, nurses being able to express their concern and be heard, and improvement with patient outcomes. However, there are also disadvantages to unionization, like negative effects of the work environment due to union activists, lower patient satisfaction, and the possibility of strikes, which can result in a loss of pay. Nurses need to carefully consider both the pros and cons of entering a unionization before applying for any job. Regardless of nurses working on union environment, ways to discuss communication strategies and develop sound relationships with their management and organization executive leaders are assessing knowledge of labor laws and practices, understand what protections are already in place, and be proactive and able to identify situations in which nurses or managers disrespect others. Nurses who assess their knowledge of labor laws can understand unique culture and can have transparent communication leaders before union activity begins or grievances are filed. A reference here is Cherry and Jacob, 2023. Understanding protections through law and regulations as a nurse can give them better protection to their rights. Lastly, being able to identify situations where nurses or managers are disrespecting one another can help with better communication and lead to a better work environment, if the problem is solved. Other ways to discuss communication strategies include participating in education and training that will improve a nurse's skills and being able to solve problems that impact patient quality and care. I do not believe a nurse can be terminated from their position by being involved with union organizing activities because the NRLA gives nurses the protection and right to engage in these activities without fear of retaliation from their employees. However, it is important for nurses to be aware of their employer guidelines regarding these activities in case they have guidelines requiring employees that they cannot engage in lawful union activities. And that is all I have.